Section 1. Introduction. A serious illness called typhoid fever. Typhoid fever is a serious infection that can affect the entire body. It is caused by a type of bacteria known as Salmonella Typhi. This is not the same bacteria that causes common food poisoning, but a much more dangerous relative. These germs primarily live inside the human gut and bloodstream. The illness is most often found in parts of the world where sanitation is poor and access to clean drinking water is limited. It is a disease that can make a person feel extremely unwell, and while it is very treatable with modern medicine, it can become deadly if it is ignored or not treated correctly. Understanding this illness is the first step toward protecting yourself and your family from its grasp. The primary way typhoid fever spreads is through the fecal-oral route. Knowing what to do and when to do it can make all the difference when facing an illness like typhoid fever. Section 2. The first signs. How typhoid fever begins. The initial symptoms are often subtle and can be mistaken for other common illnesses like the flu. During the first week, a fever gradually increases each day, low in the morning, higher by evening, leaving the person drained and exhausted. Along with fever, persistent headache, general weakness or malaise, loss of appetite. Into the second week without treatment, fever becomes high and sustained, sometimes 103 to 104 degrees Fahrenheit, 39 to 40 degrees Celsius, profound fatigue, stomach pain and abdominal discomfort, diarrhea, more common in children, constipation, more common in adults. Some people may also develop a characteristic rash, small rose-colored spots, usually on the chest or abdomen. The physical toll becomes more apparent as days turn into weeks. Vomiting and diarrhea can lead to significant weight loss and dehydration. The person may appear gaunt and listless with a coated tongue, profuse sweating, and bloating. These signs are the body's alarm bells. Bacteria have taken hold in the bloodstream and intestinal tract. Ignoring them is a dangerous gamble. Section 3. The hidden dangers. Complications you must avoid. If typhoid fever is not treated promptly, it can lead to severe and life-threatening complications, typically in the third or fourth week. One of the most serious complications is intestinal perforation. The bacteria can erode the wall of the small or large intestine, creating a hole. Contents of the intestine, full of bacteria, leak into the abdomen. This leads to a massive infection called peritonitis. It causes severe abdominal pain, nausea, and vomiting, and can quickly lead to sepsis and death without emergency surgery. Another grave complication is major internal bleeding, gastrointestinal hemorrhage. Infection damages blood vessels in the intestinal wall, causing them to rupture. A person may pass black, tarry stools, or, in severe cases, vomit blood. Significant blood loss can cause a sharp drop in blood pressure, a rapid heart rate, and shock. This is life-threatening and requires immediate hospitalization, transfusion, and sometimes surgery to stop the bleeding. Untreated or inadequately treated typhoid can relapse and cause myocarditis, endocarditis, pneumonia, or encephalopathy. Recovery after complicated typhoid is long and difficult. Quick, decisive action matters. Recognize persistent fever early, seek care, and prevent severe damage. Section 4. Unseen spread. How the bacteria travels. The human body is the primary reservoir. Bacteria multiply in the gallbladder, bile ducts, and intestines, then are shed in feces, and less commonly urine, in very large numbers. When human waste contaminates rivers, lakes, or groundwater, the chain of transmission begins. People drink, cook, or wash food with the same water, a direct path for infection. Even ice can carry the bacteria. Freezing does not guarantee safety. Infected people, including chronic carriers, can transfer bacteria to food if they do not wash hands carefully after using the toilet. Flies can mechanically move germs from waste to meals. Keep food covered and control flies. The entire cycle is preventable. Each link can be broken through sanitation, food safety, and personal hygiene. When a patient presents with prolonged fever, headache, and abdominal pain, a doctor begins a process of diagnosis. They ask when symptoms started and progressed, recent travel, and possible exposure to unsafe food or water. Physical exam includes checking temperature, listening to heart and lungs, and assessing for abdominal tenderness or enlarged spleen or liver. Symptoms overlap with malaria, dengue, and other infections. Lab tests are essential. The most reliable test is a blood culture. If Salmonella Typhi is present, it multiplies in a few days and can be identified. Stool culture can detect shedding and help find chronic carriers. Urine may be tested in some cases. In severe or difficult cases, bone marrow culture, the most sensitive test, may be used. Widal serology is less reliable. Newer rapid tests exist, but blood culture remains the gold standard. Once confirmed, clinicians can guide correct treatment, and public health teams can track and control outbreaks. The cornerstone of treatment for typhoid fever is a course of appropriate life-altering emergencies. The most effective way to protect yourself and your community is safe, clean water. If unsure, bring water to a rolling boil for at least 1 full minute. Use reliable filters or chemical tablets when boiling isn't possible. When traveling, choose properly sealed bottled water and be cautious with ice. Wash hands with soap after using the toilet, before preparing food, and before eating. Eat thoroughly cooked foods served hot. Avoid raw vegetables and salads unless washed in safe water. Choose fruits with a peel and peel them yourself. Be wary of street food unless cooked fresh in sight. Vaccines significantly lower risk. Recommended for travelers to endemic regions like South Asia, Africa, and Latin America, close contacts of carriers, and lab workers. Consult a doctor or travel clinic at least a month before travel. Long-term protection requires investment in sewage treatment, safeguarding water sources, education on hand washing and food safety, and restaurant inspections. Combining personal actions with community initiatives builds a resilient shield against typhoid fever. Amir, living in a town with an unreliable water supply, started to feel unwell. Mild headache, unusual fatigue. He remembered a recent talk on waterborne disease and switched to boiled water, told his family, rested separately, and avoided sharing utensils. By day 4, fever wasn't improving. He recognized a fever over 3 days as a warning sign. On day 5, he went to the clinic, described rising fever, headache, loss of appetite, abdominal pain, and recent water supply problems. The doctor suspected typhoid, ordered a blood culture, and began treatment without delay. Take the medicine for the full 10 days. Get complete bed rest. Keep drinking ORS. Within 2 days, his fever fell. Appetite returned. He completed every dose. Because he acted quickly, Amir recovered at home and avoided severe complications like intestinal perforation. Understanding what to do when you feel sick is as important as knowing the symptoms. Use a symptom-to-action ladder. Step by step. Each sign links to a specific action. It removes guesswork and speeds your response. The ladder escalates as symptoms worsen. Familiarize yourself to protect your health. First rung. Low-grade fever that comes and goes. Mild headache, general tiredness. Action. Monitor at home. Rest. Increase clean fluids. Check and record temperature twice daily. If low fever lasts more than 3 days, climb up. Action. See a doctor or clinic without delay. Do not self-medicate with leftover antibiotics. Describe all symptoms and any travel or unsafe food-water exposure so they can order the right tests. Highest rung, severe sharp abdominal pain. Blood in stool, red or black and tarry. Persistent vomiting. Action: immediate. Go to the nearest ER right away. Time is absolutely critical. Remember, monitor mild symptoms, see a doctor for persistent fever, seek emergency care for severe signs. Acting swiftly is your best defense. If you suspect typhoid, do not wait. Consult a healthcare professional.